and we see here is the problem. This is L3-4, which we know he injured about a year or so before we saw him, a year and a half. He had physical therapy for 9 months. It had about a year ago, perhaps a little more degeneration here. For various reasons, including his symptoms and electrodiagnostic studies, we were pretty sure this was the bad boy. This was the disc that was hurting him. Now, this is part of where the differential diagnosis comes into play, because you see on the MRI, there's 2 bad discs. There's 3-4 and 5-1, with 2 beautiful ones. And actually, the ones higher up were normal also. So which one is really bothering the patient? And that's where you have to be a doctor. And as you see, the angles are somewhat different. The angle of distraction for 5-1 is different than it would be for 3-4. He had 11 treatments with us. We recommended 20 for a disc like that, but he had 11 treatments, and he was done. He felt better. He didn't feel it was worth driving here anymore. We were fortunate enough to persuade him to have one more MRI done after the treatment. This was done February 2nd of 2000. The next MRI was done March 10th, so it's about 5-6 weeks later in 2000. What we can see is, first of all, look at the bad discs. The bad discs, the ones that we thought had lost some disc height, were bulged or protruded or herniated out a little bit, and had also lost signal, showing that they were damaged. They were starting to dehydrate. The bad disc had actually improved in hydration status because of increased signal in T2-weighted sequences. The bulge or herniation posteriorly was actually much less, which was very nice. The disc height had improved. What we do is enlarge the films, and you can measure with a micrometer the disc height at various levels, and you see he actually did have significant increase in disc height, looking at it in percentage of the vertebral body that's adjacent to it. So here we have improvement in the disc height, improvement in the herniation, and we think, just as importantly, improvement in the hydration status of the disc. We believe that the normal discs show better hydration, some improvement in disc height, and there was no herniation to fix. And interesting here, so L5-S1, we see a little bit better disc height, not much. We see a tad better hydration status. The herniation is really not significantly changed, and we believe that's because the distraction angle in this case was maximized for L3, L4. We talked about changing the distraction angle for different disc levels, and that's again why we're aiming at 3-4. That's why it makes a difference with the new distraction technologies. You've got to know what you're treating. You can't just throw everybody into the same protocol. So this was a very successful guy. To follow up, this was March 10th. This was taken 2000. Today is March of 2002. He hasn't been back here. The patient is still doing well. He was an outdoors enthusiast. He really wanted to go fishing and hunting, and he couldn't do any of those things because of the pain and disability. The July 4th, after these were taken, he redid his patio and lifted over 2 tons of bricks and had no problems. He went fishing that summer, hunting the next year, and got a big buck, and et cetera, et cetera. So he's a very happy guy. And as far as follow-up, it's 2 years. We still haven't seen him, and reports are he's doing well.